are you unknowingly sabotaging your sexual performance with herbs you think are helping you? If you're a man over 60 and you've been struggling with maintaining strong, reliable erections, the culprit might be sitting right in your medicine cabinet or kitchen pantry. You see, there's a dangerous misconception in the health world that all natural herbs are automatically safe and beneficial for men's sexual health. This couldn't be further from the truth, and it's costing thousands of seniors their confidence, their relationships, and their vitality. Before we dive into this life-changing information, if this video is already providing you with valuable insights, show your support by hitting that like button right now. And if you want to stay updated with more men's health secrets that your doctor might not tell you, make sure to subscribe and ring that notification bell. Also, I'd love to know where you're watching from. Drop your city and country in the comments below so I can see how far this important message is reaching. Now, let's get into the herbs that could be destroying your sexual health. I'm Dr. Vicky, a urologist with over 30 years of experience in men's health, and I've seen firsthand how the wrong herbal choices can actually worsen erectile dysfunction, create dangerous side effects, and even lead to emergency room visits. Today, I'm going to reveal the 4 herbs that are secretly destroying your sexual performance and the 4 powerhouse alternatives that can restore your confidence in the bedroom naturally and safely. Let's start with the harsh reality. After age 60, your body doesn't process herbs the same way it did when you were younger. Your liver function changes, your cardiovascular system becomes more sensitive, and what worked for your younger self can now become a liability. Many men are taking herbs based on outdated information or recommendations from friends, completely unaware that these so-called natural remedies are actually working against their sexual health goals. The first herb you need to eliminate from your routine immediately is yohimbe. Now, I know what you're thinking. You've probably heard yohimbe marketed as nature's Viagra. The supplement industry has been pushing this narrative for decades. But here's what they don't tell you about yohimbe and why it's particularly dangerous for men over 60. Yohimbe contains yohimbine, a compound that can cause severe cardiovascular complications, especially in older men. The herb works by blocking alpha-2 adrenergic receptors, which sounds scientific and impressive, but what this really means is that it can cause your blood pressure to spike unpredictably. Think about this for a moment. As a senior, you're likely already dealing with some level of cardiovascular concern, whether it's high blood pressure, arterial stiffness, or circulation issues. When you introduce yohimbe into this equation, you're essentially playing Russian roulette with your heart. I've treated patients who experienced rapid heartbeat, anxiety attacks, and dangerous blood pressure spikes after taking yohimbe supplements. One patient, a 67-year-old retired teacher, ended up in the emergency room with chest pains and an irregular heartbeat after taking what he thought was a natural supplement to help with his bedroom performance. But the cardiovascular risks aren't the only problem with yohimbe. This herb can also cause severe gastrointestinal distress, including nausea, vomiting, and stomach cramping. For seniors who may already be dealing with digestive sensitivities or taking medications that affect the stomach lining, adding yohimbe to the mix can create a perfect storm of digestive chaos. Additionally, yohimbe can interact dangerously with common medications that seniors take, including blood pressure medications, antidepressants, and blood thinners. The second herb that's sabotaging your sexual health is excessive ginkgo biloba. Now, you might be surprised to see ginkgo on this list because it's often promoted for circulation and cognitive function. While ginkgo can have some benefits, when used appropriately, the problem lies in how most seniors are using it. Many men over 60 are taking large doses of ginkgo biloba, thinking that more circulation equals better erections. This is a dangerous oversimplification that can lead to serious bleeding complications. Ginkgo biloba is a natural blood thinner, and when you're taking it in high doses or combining it with other blood-thinning medications like aspirin, warfarin, or even fish oil supplements, you're creating a bleeding risk that can be life-threatening. I've seen patients develop internal bleeding, bruising that won't heal, and dangerous bleeding during minor procedures because they were taking excessive amounts of ginkgo biloba without medical supervision. Furthermore, the circulation-boosting effects of ginkgo are relatively mild compared to what your body actually needs for strong erectile function. You're taking on significant bleeding risks for minimal sexual health benefits. The herb can also cause headaches, dizziness, and digestive upset, particularly in older adults whose systems are more sensitive to herbal compounds. The third herb you must avoid is Tribulus terrestris, especially the cheap, unregulated versions flooding the supplement market. Tribulus has been marketed as a testosterone booster and libido enhancer, but the reality is far different from the marketing claims. Most of the studies showing benefits from Tribulus were conducted on young, healthy men, not seniors dealing with age-related hormonal changes and health complications. For men over 60, Tribulus terrestris can actually disrupt your existing hormone balance rather than improve it. Your endocrine system at this age is delicately balanced, and introducing random herbal stimulants can throw everything off course. I've treated patients who experienced mood swings, sleep disturbances, and even enlarged prostate symptoms after taking Tribulus supplements. The bigger problem with Tribulus is the quality control issue. Most Tribulus supplements on the market are poorly regulated, meaning you have no idea what you're actually consuming. Some products contain heavy metals, synthetic additives, or even prescription drug ingredients that aren't listed on the label. This is particularly dangerous for seniors who may be taking multiple medications and can't afford unknown drug interactions. Additionally, Tribulus can overstimulate your cardiovascular system, leading to increased heart rate and blood pressure. Exactly what you don't want as a senior trying to maintain healthy sexual function. The herb can also cause kidney stress, which is concerning for older adults who may already have compromised kidney function. The fourth and perhaps most dangerous herb for senior men is raw or unprocessed epimedium, commonly known as horny goat weed. While this herb has a long history in traditional Chinese medicine, the problem isn't the herb itself. It's how it's being processed and sold in the Western supplement market. Most horny goat weed supplements available in health stores and online are using raw, unprocessed plant material that can be toxic to your liver and kidneys. Traditional Chinese medicine practitioners spend years learning how to properly prepare and dose epimedium, but Western supplement manufacturers are simply grinding up the raw plant and stuffing it into capsules. This unprocessed form contains compounds that can cause liver toxicity, particularly in older adults whose liver function is naturally declining. I've seen lab results showing elevated liver enzymes in patients taking commercial horny goat weed supplements, and in some cases, these elevations persisted even after stopping the herb. The unprocessed epimedium can also cause severe headaches, nausea, and nosebleeds. Some patients have reported heart palpitations and breathing difficulties after taking these unregulated supplements. For seniors who may already be taking medications that stress the liver, adding raw epimedium to the mix can push your liver function into dangerous territory. Now that you understand why these 4 herbs are working against your sexual health, let me share the 4 herbs that can actually help restore your confidence and performance safely. These are herbs that I recommend to my patients based on solid research and decades of clinical experience with senior men. The first herb you should consider is properly processed Korean red ginseng, specifically Panax ginseng. Unlike the dangerous herbs we just discussed, Korean red ginseng has been extensively studied in older men and has shown remarkable benefits for erectile function without the serious side effects. The key is getting the right type of Korean red ginseng that has been properly fermented and standardized for active compounds called ginsenosides. Korean red ginseng works by improving your body's nitric oxide production, which is essential for healthy blood flow to the penis. As you age, your natural nitric oxide production declines, which is one of the primary reasons why erections become weaker and less reliable. Korean red ginseng helps restore this natural process without forcing your cardiovascular system like dangerous stimulants do. Studies specifically conducted on men over 60 have shown that Korean red ginseng can improve erectile firmness, increase sexual satisfaction, and even boost overall energy levels. Unlike the herbs on the avoid list, Korean red ginseng actually supports your cardiovascular health rather than stressing it. The herb has adaptogenic properties, meaning it helps your body handle stress more effectively, which is crucial for sexual performance at any age. What makes Korean red ginseng particularly suitable for seniors is its gentle, sustained action. Rather than creating dramatic spikes in blood pressure or heart rate, it works gradually to improve your body's natural sexual response mechanisms. Patients often report that their erections feel more natural and sustainable when using Korean red ginseng compared to synthetic alternatives. The recommended dosage for seniors is typically lower than what younger men might take, usually around 600 to 900 milligrams of standardized extract daily, taken with food to minimize any potential stomach irritation. The effects build over time, so you need to be patient and consistent rather than expecting immediate results like you might with dangerous stimulant herbs. The second herb that can transform your sexual health is Rhodiola rosea, an adaptogenic herb that addresses one of the most overlooked aspects of sexual dysfunction in seniors: stress and fatigue. Many men over 60 struggle with sexual performance, not because of physical problems alone, but because of the combined effects of stress, poor sleep, and general fatigue that come with aging and life circumstances. Rhodiola rosea works by supporting your adrenal glands and helping your body maintain steady energy levels throughout the day. When your energy is stable and your stress levels are manageable, your sexual function naturally improves. This herb has been used for centuries in traditional medicine, but modern research has validated its effects on both physical and mental performance. What's particularly impressive about Rhodiola is its ability to improve what researchers call sexual satisfaction scores in older adults. This isn't just about achieving erections. It's about enjoying the entire sexual experience, feeling present and engaged, and having the energy to be an active participant in intimacy. Many of my patients report that Rhodiola helps them feel more like their younger selves in terms of sexual enthusiasm and stamina. Rhodiola is also remarkably safe for seniors when taken at appropriate doses. Unlike stimulant herbs that can cause jitters or cardiovascular stress, Rhodiola actually promotes a sense of calm alertness. It can help improve sleep quality, which is essential for healthy testosterone production and overall sexual function. The typical dosage for seniors is 200 to 400 milligrams of standardized Rhodiola extract, taken in the morning with breakfast. Taking it later in the day might interfere with sleep for some people, although this varies by individual. The effects are usually noticeable within 2 to 4 weeks of consistent use. The third herb that belongs in your sexual health arsenal is ashwagandha, specifically the KSM 66 extract that has been clinically studied in older men. Ashwagandha is another adaptogenic herb, but its primary benefit for sexual health comes from its ability to support healthy testosterone levels and reduce cortisol, the stress hormone that can devastate sexual function. As men age, testosterone levels naturally decline, but chronic stress can accelerate this decline dramatically. High cortisol levels from ongoing stress actually signal your body to shut down testosterone production, creating a vicious cycle where stress kills your sex drive, and poor sexual function creates more stress. Ashwagandha breaks this cycle by lowering cortisol levels while supporting your body's natural testosterone production. Clinical studies on men over 60 have shown that ashwagandha can increase testosterone levels by 15 to 20% when taken consistently over 8 to 12 weeks. More importantly, men taking ashwagandha report improvements in libido, erectile quality, and overall sexual satisfaction. The herb also improves muscle strength and reduces fatigue, which can enhance your physical capacity for sexual activity. What makes ashwagandha particularly valuable for seniors is its safety profile. Unlike synthetic testosterone boosters or dangerous herbal stimulants, ashwagandha works with your body's natural systems rather than forcing dramatic changes. It's also been shown to support prostate health, which is a crucial consideration for men over 60. The KSM 66 extract is important because it's the specific form that has been studied in clinical trials. The dosage typically ranges from 300 to 600 milligrams daily, taken with meals to enhance absorption. Some men prefer to split the dose, taking half in the morning and half in the evening, while others find taking the full dose in the morning works better for their schedule and energy patterns. The fourth and final herb that can revolutionize your sexual health is maritime pine bark extract, also known as pycnogenol. This might be the most underrated herb for senior men's sexual health, yet it's one of the most scientifically validated. Maritime pine bark extract contains powerful antioxidants called proanthocyanidins that specifically target the vascular problems that cause erectile dysfunction in older men. Here's what makes this herb so effective for seniors. Erectile dysfunction in men over 60 is primarily a vascular problem. Your blood vessels become less flexible, your circulation decreases, and oxidative stress damages the delicate tissues that control blood flow to the penis. Maritime pine bark extract addresses all of these issues simultaneously. The proanthocyanidins in maritime pine bark extract help restore flexibility to your blood vessels, improve nitric oxide production, and protect your vascular system from further oxidative damage. Clinical studies have shown that men taking maritime pine bark extract experience significant improvements in erectile function, often within 4 to 6 weeks of starting supplementation. What's particularly impressive is that maritime pine bark extract doesn't just mask symptoms. It actually helps repair some of the underlying vascular damage that causes erectile dysfunction. This means that the benefits often continue even after you stop taking the herb, unlike quick-fix solutions that only work while you're actively using them. The herb is also incredibly safe for seniors, with no reported interactions with common medications and no significant side effects when taken at recommended doses. Some men even report improvements in other areas of circulation, such as reduced leg cramping and better cold tolerance, which indicates that the vascular benefits extend throughout the entire body. For seniors, the recommended dosage is typically 100 to 200 milligrams of standardized maritime pine bark extract daily, taken with meals. The extract should be standardized to contain at least 95% proanthocyanidins to ensure you're getting the active compounds that provide the sexual health benefits. Now, let me share some crucial information about how to implement these 4 beneficial herbs safely and effectively. The biggest mistake I see senior men make is treating herbs like prescription medications, taking them sporadically or expecting immediate results. Herbs work differently than synthetic drugs, and this is actually an advantage when you understand how to use them properly. First, consistency is absolutely essential. These 4 herbs, Korean red ginseng, Rhodiola rosea, ashwagandha, and maritime pine bark extract, need to be taken daily for at least 6 to 8 weeks before you can evaluate their full effects. Your body needs time to respond to the gentle, natural compounds and to rebuild the systems that support healthy sexual function. Second, quality matters more than you might realize. The supplement industry is poorly regulated, and this is especially problematic for herbal products. You want to look for herbs that are third-party tested for purity and potency, preferably with certificates of analysis available from the manufacturer. Avoid bargain basement herbs from unknown suppliers, as these often contain contaminants or have little to no active ingredients. Third, timing can significantly impact effectiveness. Korean red ginseng is best taken in the morning with food, as it can be energizing and might interfere with sleep if taken late in the day. Rhodiola should also be taken in the morning for the same reason. Ashwagandha can be taken either morning or evening, but many men find it helps with sleep quality when taken before dinner. Maritime pine bark extract can be taken at any time with meals. Fourth, start with lower doses and gradually increase. Even though these herbs are safe, your body needs time to adjust to new compounds. Starting with the lower end of the recommended dosage range for the first 2 weeks, then gradually increasing to the full dose can help minimize any minor digestive upset or adjustment reactions. Here's something crucial that most men don't realize. These 4 herbs work synergistically, meaning they're more effective when used together than when used individually. Korean red ginseng improves blood flow, rhodiola reduces stress and fatigue, ashwagandha supports hormone balance, and maritime pine bark extract repairs vascular damage. Together, they address all the major factors that affect sexual function in senior men. However, you don't need to start all 4 herbs at once. In fact, I recommend introducing 1 herb at a time, spacing them about 2 weeks apart. This allows you to monitor how your body responds to each herb individually and helps you identify which ones are providing the most benefit for your specific situation. Let me address some common concerns that senior men have about using herbs for sexual health. The first concern is safety, particularly regarding interactions with medications. While the 4 herbs I've recommended are generally safe, you should always consult with your healthcare provider before starting any new supplement regimen, especially if you're taking prescription medications. Korean red ginseng can potentially interact with blood-thinning medications and diabetes medications, so close monitoring may be necessary if you're taking these drugs. Rhodiola is generally very safe, but should be used cautiously if you're taking antidepressants or anti-anxiety medications. Ashwagandha is safe for most people, but may enhance the effects of medications for diabetes or blood pressure. Maritime pine bark extract is the safest of the 4 and has no known significant drug interactions. The second common concern is cost. Many men worry that high-quality herbal supplements are expensive, and this can be true if you're buying premium products. However, when you compare the cost of these herbs to the price of prescription erectile dysfunction medications, the herbs are actually much more economical. Plus, unlike prescription drugs that only work for a few hours, these herbs provide ongoing benefits that improve your overall health and vitality. To help manage costs, consider buying larger quantities when you find high-quality products, as bulk purchasing often reduces the per-dose cost significantly. Also, remember that you're not just buying herbs for sexual health, you're investing in compounds that support cardiovascular health, stress management, hormone balance, and overall vitality. The third concern is about realistic expectations and timeline. Many men have been conditioned by pharmaceutical marketing to expect immediate results, but herbs work differently. The 4 herbs I've recommended typically begin showing subtle effects within 2 to 4 weeks, with more noticeable improvements occurring between 6 to 8 weeks of consistent use. This gradual improvement is actually a benefit, not a drawback. Rather than creating artificial short-term effects, these herbs are helping restore your body's natural sexual function capabilities. The results tend to be more sustainable and often continue improving the longer you use them, up to about 6 months, when most men reach a plateau of maximum benefit. Let me share some specific success stories from my practice to illustrate how these herbs can transform sexual health for senior men. Robert, a 64-year-old retired engineer, came to me after struggling with erectile dysfunction for 3 years. He had tried prescription medications, but they gave him severe headaches and didn't work consistently. He was also taking some of the dangerous herbs I mentioned earlier, including yohimbe and raw horny goat weed, which were causing sleep problems and anxiety. We immediately discontinued the problematic herbs and started him on Korean red ginseng and maritime pine bark extract. Within 6 weeks, Robert reported that his erections were stronger and more reliable than they had been in years. More importantly, he felt like the improvements were natural. He wasn't dependent on timing a pill or dealing with side effects. 8 months later, Robert maintains excellent sexual function and has even been able to reduce his reliance on prescription medications. Another patient, Frank, a 68-year-old retired teacher, was dealing with the devastating combination of low energy, poor sleep, and complete loss of sexual interest. His wife was beginning to think he was no longer attracted to her, which was creating significant relationship stress. Frank had been taking Tribulus terrestris and excessive amounts of ginkgo biloba, thinking they would boost his testosterone and circulation, but they were actually making his sleep problems worse. We stopped the problematic herbs and implemented a protocol using Rhodiola rosea and ashwagandha. The changes were remarkable. Within a month, Frank's energy levels improved dramatically. His sleep quality was the best it had been in years, and his interest in intimacy returned. His wife later told me that it was like getting her husband back after years of watching him struggle with fatigue and disinterest. These success stories aren't unusual. They represent the typical outcomes I see when men make the switch from dangerous herbs to the safe, effective alternatives I've outlined today. The key is having the patience to allow the herbs to work naturally and the commitment to use them consistently. Now, let's talk about lifestyle factors that can dramatically enhance the effectiveness of these 4 herbs. No herb, no matter how powerful, can overcome the effects of poor lifestyle choices that directly sabotage sexual function. The good news is that the lifestyle changes that support sexual health also improve your overall quality of life as a senior. Sleep quality is absolutely critical for sexual function, yet it's often overlooked in discussions about erectile dysfunction. During deep sleep, your body produces the majority of its testosterone and performs essential repair processes that maintain healthy blood vessel function. If you're not getting quality sleep, even the best herbs won't be able to fully restore your sexual vitality. The herbs I've recommended, particularly Rhodiola and ashwagandha, can help improve sleep quality, but you need to support them with good sleep hygiene. This means maintaining a consistent bedtime routine, keeping your bedroom cool and dark, avoiding screens for at least an hour before bed, and limiting caffeine intake after 2 p.m. Cardiovascular exercise is another crucial factor that works synergistically with the herbs to improve sexual function. You don't need to become a marathon runner, but regular walking, swimming, or cycling can dramatically improve the circulation benefits you get from Korean red ginseng and maritime pine bark extract. Even 30 minutes of moderate exercise 3 times per week can make a significant difference in sexual function within 6 to 8 weeks. Stress management is where Rhodiola and ashwagandha really shine, but you can amplify their effects with simple stress reduction techniques. Deep breathing exercises, meditation, or even just spending time in nature can help lower cortisol levels and create an environment where your sexual function can flourish. Chronic stress is one of the biggest killers of sexual desire and performance in senior men, so addressing it is essential for success. Diet plays a huge role in sexual health, and certain foods can either support or undermine the effects of the herbs you're taking. Foods rich in antioxidants, such as berries, dark leafy greens, and colorful vegetables, work synergistically with maritime pine bark extract to combat oxidative stress. Foods high in zinc, such as oysters, pumpkin seeds, and grass-fed beef, support the testosterone-boosting effects of ashwagandha. On the flip side, processed foods, excessive sugar, and trans fats can create inflammation and oxidative stress that counteract the benefits of even the most potent herbs. You don't need to follow a perfect diet, but making gradual improvements in your food choices can significantly enhance your results. Hydration is often overlooked, but critically important for circulation and sexual function. Dehydration can reduce blood volume and make it harder for your body to achieve and maintain erections, even when taking circulation-supporting herbs like Korean red ginseng. Aim for at least 8 glasses of water daily, and consider reducing alcohol intake, as alcohol can interfere with both sexual function and the absorption of herbal compounds. Let me address one final crucial point about monitoring your progress and knowing when to seek additional help. While the 4 herbs I've recommended are safe and effective for most senior men, sexual health issues can sometimes indicate underlying medical conditions that need professional attention. If you've been consistently using these herbs for 3 to 4 months without significant improvement, it's important to have a comprehensive evaluation with a urologist or men's health specialist. Sometimes erectile dysfunction can be an early warning sign of cardiovascular disease, diabetes, or hormonal imbalances that require medical treatment in addition to herbal support. Keep a simple journal tracking your sexual function, energy levels, sleep quality, and overall well-being as you implement these herbs. This information can be invaluable for both you and your healthcare provider in determining whether the herbal approach is sufficient or whether additional interventions might be beneficial. Remember, seeking professional help isn't a sign of failure, it's a sign of wisdom. The goal is to restore your sexual health and vitality using the safest, most effective methods available, whether that's herbs alone or herbs combined with other treatments. In conclusion, the 4 herbs you must avoid, yohimbe, excessive ginkgo biloba, tribulus terrestris, and raw epimedium, are sabotaging your sexual health and potentially endangering your overall well-being. The 4 herbs you should embrace are Korean red ginseng, Rhodiola rosea ashwagandha, and maritime pine bark extract offer a safe, natural path to restored sexual confidence and vitality. The choice is yours. But now you have the knowledge to make an informed decision based on science, safety, and decades of clinical experience. Your sexual health doesn't have to decline with age, and you don't have to accept erectile dysfunction as an inevitable part of getting older. With the right herbs, the right approach, and the commitment to consistency, you can reclaim the confidence and vitality that make life truly worth living. Take action today, but take it wisely. Your future self will thank you for making the smart choice. If this video has opened your eyes to the truth about herbs and men's sexual health, I need you to do 3 things right now. First, smash that like button to help this crucial information reach more men who desperately need to hear it. Second, subscribe to this channel and hit the notification bell, because I'm constantly sharing life-changing health secrets that could save your life and restore your vitality. And third, share this video with any man in your life who might be unknowingly taking dangerous herbs. You could literally be saving them from serious health complications. Don't forget to tell me in the comments which of these 4 beneficial herbs you're most excited to try. And remember to share where you're watching from. I read every single comment and love connecting with viewers from around the world. Until next time, stay strong, stay healthy, and remember your best years can still be ahead of you.